Hello, this is Dr. Roberto Flores, Director of Cleft Lip and Palate at the Hangzhou Beast Department of Plastic Surgery at NYU Langone Health. Today I'm thrilled to discuss a paper entitled Alar Base Symmetry in Orthognathic Surgery, Patients with a Unilateral Cleft. This is a paper written by senior author Lunju Lo of Chengge Memorial Hospital. This single-center retrospective review assesses 84 patients with Class 3 malocclusion using cone beam computed tomography to assess changes to the alar base in response to surgery. The two study groups comprise of 42 patients with a unilateral cleft and 42 patients without a cleft. Patients who underwent multi-piece osteotomy at the Lefort 1 level or who had autogenous grafting in the form of fat, bone, or cartilage at the alar base were excluded from the study, as were patients with hemifacial microsomia. Patients were assessed preoperatively and at least 6 months postoperatively through radiographs to assess soft tissue and bony changes to the alar base. The authors found preoperative discrepancy in the alar base position in patients with unilateral cleft. At the bony level, there was a protrusion of the alar base on the cleft side in 76% of the patients. The average discrepancy was 3 millimeters posterior on the cleft side. However, when looking at the soft tissue surface in patients with a cleft, there was an anterior protrusion on the cleft side in 67% of the patients, and this anterior discrepancy was 1.4 millimeters. The preoperative bony asymmetry did not change in response to surgery. However, the surface soft tissue asymmetry did improve in response to surgery. The ratio of soft tissue changes between the cleft and non-cleft side was less on the cleft side. The authors attribute this change to scarring underneath the alar base. The authors conclude that the alar base asymmetry improves in response to maxillary surgery. However, there's a differential response between the bony movements and the soft tissue movements in response to surgery, and these differential changes should be kept in mind when performing surgical planning in this patient population. While I found this study well executed, I was curious about what aspects of the reported findings could be generalizable to all patients with a cleft, and what aspects I could use to inform my practice. For instance, all patients in the study underwent a specific type of cleft rhinoplasty. During orthognathic surgery, the patients underwent an alar cinching procedure. Also, there was a great variance in the measured outcomes in this study, raising the question of how these findings could be accurately applied to each individual patient in the future. Finally, I would note that mature cleft rhinoplasty provides an excellent opportunity to correct alar base asymmetry after orthognathic surgery. I'd like to thank Dr. Lo for this well-executed study and the PRS Journal for this opportunity to discuss these findings with you.